These are the two most important questions. A month ago, WHO and partners launched the SET, or the ACT Accelerator, the speed up the development, production and equitable distribution of vaccines, diagnostics and therapeutics for COVID-19. Today, we're joining 37 countries and numerous partners to launch the COVID-19 Technology Access Pool, or CTAP. CTAP was first proposed by His Excellency President Carlos Alvarado of Costa Rica, and I would like to thank His Excellency, the President, for and solidarity. CTAP is a sister initiative of the ACT Accelerator and offers concrete actions to achieve the objective of the ACT Accelerator, which is equitable access. CTAP has 5 priorities. First, public disclosure of gene sequencing research. Second, public disclosure of all clinical trial results. Third, encouraging governments and research funders to include clauses in contracts with pharmaceutical companies about equitable distribution and publication of trial data. Fourth, licensing treatments and vaccines to large and small producers. And fifth, promoting open innovation models and technology transfer that increase local manufacturing and supply capacity. Through CTAP, we're inviting companies or governments that develop an effective therapeutic to contribute the patent to the medicines patent pool, which would then sub-license the patent to generic manufacturers. CTAP is voluntary and builds on the success of the medicines patent pool in expanding access to treatments for HIV and hepatitis C. WHO recognizes the important role that patents play in fueling innovation. But this is a time when people must take priority. Tools to prevent, detect, and treat COVID-19 are global public goods that must be accessible by all people. Science is giving us solutions, but to make the solutions work for everyone, we need solidarity. COVID-19 has highlighted the inequalities of our world, but it's also offering us an opportunity to bring those inequalities and build a fairer world, a world in which health is not a privilege for the few, but a common good. Now it gives me enormous pleasure to introduce His Excellency Carlos Alvarado, the President of Costa Rica. Muchas gracias, Presidente Alvarado, mi hermano. Mucho gusto por su liderazgo.
Thank you very much.
Thank you. Muchas gracias. I think it's muted.
Okay.
Hannah, can you?
Mi hermano, can you hear me? Gracias, Dr. Tedros, mi hermano,
Thank
my
you,
brother.
Dr. Tedros.
Un saludo.
My greetings.
Para Costa Rica es un honor
Costa Rica,
ser
it is
parte
an
de
honor
una acción colectiva
to be
que
part
envía un
of
mensaje potente a
this
toda la
joint
humanidad
work, which will
sobre las
send
cosas
a strong
maravillosas
message
que
to all of
podemos
humanity
y
of the
somos
wonderful
capaces
things
de
that we can
impulsar en
do and we are
conjunto
capable
para el
of
resguardo del
bringing about
bienestar
together
de todas las
to
personas.
care for the well-being of all.
Hoy se trata de hacer un llamado a la esperanza,
to
sobre
call
todo para las personas más vulnerables en las
particularly for
distintas
the most
partes del
vulnerable
mundo.
people throughout the
Hoy,
world.
líderes estatales,
Today,
altos representantes de organismos
leaders of states and high
multilaterales, del sector
representatives of
privado, de la
multilateral
academia y de la
organizations,
sociedad civil,
from academia
unimos
and
voces
social
para
and
anunciar
civil
que
society
hemos
are
asumido
joining
un compromiso
to say
solidario
that we have
con la
made
vida,
a
la dignidad humana y la
commitment of
cooperación
solidarity to
internacional.
work for
La
human
pandemia del
dignity and
COVID-19
international
marcará
solidarity.
un
The
antes y un después en la
COVID-19
historia de la humanidad,
pandemic will
no
show
solo
a
por lo
before
que ha
and an
significado
after
para
in
nuestros
the
sistemas de
history of
salud
humanity,
y para
not
la
only in terms
convivencia
of our
y
healthcare
relacionamiento
systems,
entre
but also
personas,
for
sino
working
también
together and
porque,
for
a pesar
relationships
de la
between
crisis que
people.
hemos tenido que
Because
enfrentar,
despite the
tenemos
crisis
la
we've had to face,
oportunidad
we
de
have
tomar
an
decisiones
opportunity to
conjuntas
take
que
joint
cambien
decisions
para bien
which will
el
change
futuro de la
for good
población
the
mundial
future
en
of
el
the
corto
world
y mediano plazo.
population in the short and medium.
Se presenta ante nosotros el desafío de toda
So
una
we
vida,
have a challenge of a
garantizar el
lifetime
acceso
to guarantee
universal a
universal
las
access
tecnologías
to
sanitarias que
health
requerimos para hacer
technologies
frente
that we
al
need to
COVID-19.
face
La
COVID-19.
promesa de descubrimientos
The
científicos
promise
seguros,
of
efectivos
sure
y
and safe
asequibles,
and
como
effective
tratamientos y
affordable
medicamentos,
healthcare
vacunas,
solutions
debe
such
ser
as
el vehículo
treatments
que
and
oriente nuestras
vaccines
acciones
must
y
be
nos
the
permita
guide for our
sobrellevar
actions, and it will
una
allow us
crisis que
to
ha dejado
overcome a
tanto dolor
crisis
en
which has
tantas
left behind
comunidades
so much
alrededor del
pain
orbe.
in so many
Sin
communities throughout the
embargo,
world.
de nada nos sirve
Nevertheless,
alcanzar
there
estos
is no point in
increíbles desarrollos
achieving these
tecnológicos si
amazing
no podemos
technological
garantizar
developments if
el
we cannot
acceso
guarantee
asequible a las
affordable
tecnologías.
access to technology.
Al inicio de la pandemia,
At the beginning of the
solicité al doctor
pandemic,
general de
I
la
called
OMS,
on
mi
the
estimado
Director
amigo y
General
hermano,
of
el
the
doctor
WHO,
Tedros
my dear
Adhanom
friend,
Ghebreyesus,
Tedros,
que construyéramos juntos un
help us
mecanismo que
build
nos
together
permitiera
a
poner a
mechanism that
disposición de
would
todos
help
los
us to make
estados del
available
mundo
to all
las
states
tecnologías en
throughout the
salud
world
que
the
se
healthcare
desarrollen
technologies
en la
that will be
lucha
developed
contra el
in the
virus y la
fight
enfermedad que
against
ocasiona.
this virus and
Durante
the
las últimas
disease it brings.
semanas, el esfuerzo conjunto
In recent
nos
weeks,
ha
this
permitido
joint
construir
effort
este
has helped
llamado
us to
solidario de
put
acción,
together this
mediante el cual tendremos
call
una
for
plataforma para
solidarity and
compartir
action
de manera
to give us a
abierta,
platform so we can
voluntaria
share
y
openly on a
colaborativa
voluntary
el
basis and in a
conocimiento, los
collaborative way
datos y la
the
propiedad
data
intelectual
and the
que se
intellectual
genere
property
alrededor
that
del
will be
mundo,
generated
convirtiéndola
throughout
en
the
un
world
bien
in order to make it
público global,
a public
un bien público global.
global good.
Durante la Asamblea Mundial de la
During
Salud
the
número
World Health
73,
Assembly,
realizada de
the
manera
73rd
innovadora
WHA,
hace tan solo
which
2
was held
semanas,
in such an
muchos
innovative
Estados
manner
miembros de la Organización
recently,
Mundial de la
the
Salud
member states
alzaron la
of
voz
the World Health
y
Organization
respaldaron
raised their
el
voices
desarrollo de
and
esta
supported
iniciativa,
the development
la
of
cual
this initiative.
permitirá
And
que
it will
todos los
allow
países tengamos
all
acceso a las
countries to have
soluciones que
access
nos
to
permitan
solutions
protegernos
which will
entre
help us
todos,
protect us,
asegurándonos de no dejar
protect
a
ourselves,
nadie
and to ensure
atrás.
that we leave nobody
En
behind.
este camino se han sumado
On
países de
this path,
todas las regiones y rincones
countries
del
from
mundo,
all
a
regions
quienes
and
les
areas of the
expreso
world
mi más
have
profundo
joined
agradecimiento,
their forces, and I'm most
dado
grateful to
que
them.
han sobrepuesto el bienestar de su
Given
población por encima de
that
cualquier otro fundamento.
They have
Mi
put above
profundo
all the
agradecimiento
well-being of
para
others, so I'm
Argentina,
most grateful to
Bangladesh,
Argentina, Bangladesh,
Barbados,
Barbados,
Bélgica, Belice,
Belgium,
Bután,
Belize,
Brasil,
Bhutan, Brazil,
Chile,
Chile,
Ecuador,
Ecuador,
Egipto, Honduras,
Egypt, Honduras,
Indonesia, Líbano,
Indonesia,
Luxemburgo,
the
Malasia,
Lebanon,
Maldivas,
the
México,
Maldives,
Mongolia,
Mexico,
Mozambique,
Mongolia,
Noruega,
Mozambique,
Oman,
Norway,
Países
Oman,
Bajos,
the
Pakistán,
Netherlands,
Palau,
Pakistan,
Panamá,
Palau,
Perú,
Panama, Peru,
Portugal,
Portugal,
República Dominicana,
the Dominican
San Vicente y
Republic,
las Granadinas,
St. Vincent and
Sudáfrica,
Grenadines,
Sri
South
Lanka,
Africa, Sri
Sudán,
Lanka,
Timor
Sudan,
del Este,
Timor
Uruguay
del Este,
y Zimbabue.
Uruguay, and Zimbabwe.
Aquellos jefes de Estado y
Those
jefes
heads
de
of
gobierno
state and
que
heads
aún
of
no se han
government
sumado a este
who
esfuerzo,
haven't yet
los
joined this
invito a no dejar pasar la
initiative, I
oportunidad
invite you
y
to
ser
not miss
parte
this
de un
opportunity
hecho
and to be
histórico
part
para la humanidad.
of a historic
Les
event
garantizo que
for
nada
humanity,
será más reconfortante y
because nothing
gratificante
will
que,
be more
dentro de unos años,
pleasing than
cuando
in some
historiadores
years
analicen
when
este momento
historians look
crucial,
at this crucial moment,
vean que
that you
todos
will
nuestros
see
países
that
fueron
all of our
parte de
countries
los
were
actores
part
internacionales
of
que
the
dieron un
international
paso adelante
stakeholders
y
who
tomaron
took
una
a
decisión
step
visionaria
forward
y
and
más
took a
importante aún,
visionary decision
profundamente humana.
for
Como gobernantes
great
debemos respaldar este
humanity.
llamado
So we
solidario,
must support this
declarando
call of
nuestro
solidarity
apoyo al
by
reservorio,
joining
en inglés
the support
llamado
to this, to
COVID-19
the
Technology
COVID-19
Access
Technology
Pool, CAP,
Access Pool,
de conocimientos de propiedad intelectual y datos.
which will look at
Debemos
knowledge and
alentar a nuestras
intellectual
empresas
property.
públicas y privadas,
We must call
así
on our
como a nuestras instituciones de
public and
investigación,
private companies
para
as
que
well as our
contribuyan de
research
manera
institutes so that
voluntaria
they can
a la
contribute
plataforma de
in a
intercambio.
voluntary way to the exchange
Se nos han
platform.
sumado igualmente actores
We have also
del ámbito
seen
internacional
actors from the
que han dedicado
international
su labor a la
area
búsqueda del
who
bienestar de
have
las
been dedicating their
poblaciones que
work
más
to
sufren.
find
Su vocación de
solutions to the
servicio y
well-being of the
proactividad
populations that
merecen
suffer the
también
most. So
mi
their
reconocimiento.
activity also
Igualmente al sector
deserves
privado
my recognition.
se nos ha acercado
This
con el
private
afán de
sector
conocer la
has come
propuesta
to us
e
to
identificar cómo
understand the
pueden ser
proposal and
parte
to
de ella.
identify how they can
Celebro
be
este
part of
paso al
it.
frente
So
de quienes
I
han entendido
celebrate
que solo
this
en
step
alianza desde lo
because
público y
those who
lo
have
privado
understood that
podremos
only
construir
through a
un futuro mejor.
public-private partnership can
Un
we
futuro
build a
donde
better
todos
future.
los
A
brillantes
future where
avances científicos de
all
nuestras
of the brilliant
sociedades
scientific
sean
advances of
pilares
our
en la
societies will be
construcción
pillars
de
in
un
the
horizonte
building
que
of a
dignifique cada vida.
horizon
Un
which
futuro
will
donde
give
nuestras
dignity to
capacidades
each
sean
life,
potenciadas
and
para
a
seguir
future where our
cimentando
capacity
el
will be
camino
made
del desarrollo sostenible.
stronger so that we can work towards
Para citar un
sustainable
ejemplo de
development.
buenas prácticas en Costa
To
Rica,
give an
el
example of
sector
good
privado
practices in
también ha
Costa Rica,
ofrecido
the private
su
sector has
contribución.
also offered its
El compromiso de
contribution,
la industria
the
es necesario
commitment
para
of
hacer eco
industry,
a este llamado
which is
solidario.
necessary to
Boston
answer this call
Scientific,
of solidarity.
en
Boston
conjunto con la
Scientific,
Universidad de
with
Minnesota,
the
bajo el concepto de
University of Minnesota,
solidaridad y
under the concept
responsabilidad
of
social
solidarity
corporativa,
and
le ha
social
brindado la
responsibility,
preaprobación al gobierno utilizar de forma
has
abierta
given
el diseño
pre-approval
del
for the
ventilador
open use of the
Covent
design of the
con
Covent
el fin de que este dispositivo
ventilator,
médico
so that
pueda
this
ser
medical
fabricado de
device
manera
can
local
be
a través de las
manufactured on
compañías
a
que así lo deseen.
local level by companies
La
that wish to do so.
solidaridad dentro
Solidarity
y entre los países y el sector
within
privado
and between
es
countries
esencial si
and the
queremos
private
superar
sector
estos
is
tiempos
essential if we
difíciles.
want to overcome
Necesitamos
these
liberar
difficult
todo el
times.
poder de la
We need
ciencia
to
para
free up
ofrecer
all of the power of
innovaciones
science
que
so that
sean
we can
escalables,
carry out innovation
utilizables
which
y que
is
beneficien a
scalable and
todos
can be
en todas
used and
partes al mismo
assist
tiempo.
all
Solo
in
por
all
medio de la
parts of the world.
aceleración de la
It's only through the
investigación y del
acceleration of
desarrollo
research
de
and
tecnologías
development
sanitarias
of
contra el COVID-19
technologies
es que
against
podremos salir adelante.
COVID-19 that we will be
Sin
able
embargo,
to
ningún
succeed.
Estado podrá haber superado la
Nevertheless,
pandemia
no
hasta
country
que
will
todos la
be able
hayamos
to
superado,
overcome the
por lo
pandemic
que estos
until we
desarrollos
have
deben
all
ser
overcome it.
asequibles para
So
todos.
the developments must
Por eso
be
invito a las
affordable
industrias y
for all.
sectores
That's
académicos,
why I call on
así como he
industries
invitado a la
and
industria y
academic
academia
sectors,
costarricense a que
just as
registre y
in Costa
comparta
Rica,
su
that they register
conocimiento,
and share
propiedad
their
intelectual
knowledge
y
and their
datos de
intellectual property
tecnologías
and
sanitarias existentes y
data
nuevas
and
para
healthcare
combatir COVID-19
technologies
por el bien de
so that
toda
we
la
can
humanidad.
overcome
La Universidad de
COVID-19 for
Costa
all
Rica
of
ha
humanity.
desarrollado y
The
pone a
University of
disposición
Costa
de la
Rica
humanidad
has developed and
un
makes available
protocolo
to
para la
humanity
manufactura a partir del
protocol
plasma
for
de
the
pacientes
manufacture
convalecientes
from
de
convalescing
preparaciones
patients'
inyectables
plasma,
de
injectable
inmunoglobulinas
materials
humanas
of human
hiperinmunes contra el
hemoglobins, which are
SARS-CoV-2 para el
hyperimmune
tratamiento de
to
pacientes en
SARS-CoV-2
estado severo
for the
y
treatment of
crítico de la
severely
infección.
ill patients.
También estas dos iniciativas relacionadas
These two
con
initiatives,
el diseño y
which are related
validación
to
de
the
isopos para
design
las
and
pruebas
validation
diagnósticas del
of the
COVID-19
diagnostic
y el
tests for
desarrollo de los prototipos de
COVID-19,
respiradores para
such as the
posteriormente
development
trasladar
of
el
ventilators so that
conocimiento del
the
sector
knowledge
industrial.
can then be
El
transferred.
Instituto Tecnológico de Costa Rica
The Technological
se hace
Institute of
presente en
Costa
este
Rica
repositorio y nos
is
ha autorizado para
in
que
this
Costa Rica
repository and has
ponga a
allowed us so
disposición
that Costa
internacional
Rica can make
tres
internationally
diferentes
available
iniciativas que se
three
trabajan
different
para combatir
initiatives
el
which are being worked
COVID-19.
on to fight
El
against
desarrollo de
COVID-19.
mascarillas
The
tipo
development of,
N95,
N95
el diseño de
face masks,
cobertores para
the
camillas
design
de ambulancias para
of
la Cruz
covers
Roja,
for
el
stretchers
ventilador
for
mecánico
the Red
de
Cross
accionamiento
ambulances
neumático.
and a
Por su parte, el Centro
mechanical
Nacional de
ventilator
Innovaciones Biotecnológicas,
and the
CENEBIOT,
Center
pone a disposición
for
de este repositorio
Biotechnological
un proyecto que
Development
consiste en
has put forward
optimizar
a project
protocolos
which
escalables de
optimizes
detección de
scalable
virus
protocols for the
SARS-CoV-2
detection of
que
the virus
prescinden del uso de
SARS-CoV-2,
kits comerciales
which come from
y
the use of
minimiza
commercial
la
kits
dependencia
and
de sistemas
minimize the
robóticos.
dependence.
El objetivo es crear
The aim
alternativas
is
en
to
caso de
create
escasez de kits
alternatives if there
y
is a
facilitar
scarcity
su
of kits
implementación
and to
en
facilitate
regiones
their
con acceso
application
limitado
in
a
regions
sistemas
with
robóticos.
limited access
La
to
propuesta está
robotic
inspirada
systems.
en casos de
This
éxito
is
obtenidos
inspired
en
from
Uruguay,
success stories
España
that we've
y
seen
por
in
el
Uruguay,
consorcio
Spain,
Quick COVID,
and
pero se
the
adaptó a la
COVID
realidad
consortium.
regional y los
But it
resultados
adapts to
se
the
pueden
regional
compartir
reality and the
libremente.
results can be shared freely.
Nuestra sociedad civil, siempre
Our
activa y
civil
pujante,
society
es fundamental en el proceso,
is
defendiendo la
essential in the
iniciativa
process
y abogando para que
by
más y más actores
advocating
se
to
integren
ensure
de
that
manera
more and
solidaria.
more actors
Por ejemplo,
join in
su
a
papel será
way of
importante
solidarity.
para
For
convencer a
example,
los
it's
titulares
important
de los derechos de que se
the
necesitan
rights
ser
holders
socios
be
en esta
convinced
iniciativa.
that they need to be partners
El
in our
conocimiento
initiative.
compartido, la propiedad
Shared
intelectual
knowledge,
y los
intellectual
datos
property,
abiertos
and
cristalizarán
open data
nuestros
will
esfuerzos
make
colectivos
real our collective efforts
para avanzar en el
in order to
descubrimiento
advance
científico,
in
el
scientific
desarrollo
discovery,
tecnológico y el amplio
technological
intercambio
development,
de los beneficios del
and
avance
the change
científico
of the
y
benefits
sus
of scientific
aplicaciones
process,
basadas
progress
en
and its
el
use
desarrollo de la salud.
based on the development
Esta
of
iniciativa
health.
establece un modelo
This
viable
initiative
para
sets up a
promover el
viable
acceso
model to
basado
promote
en la
access
equidad,
based on
la
equity,
ciencia sólida,
solid
la
science,
colaboración abierta y
open
la
collaboration,
solidaridad global.
and global
La solidaridad
solidarity.
global acelerará la
Global
ciencia
solidarity
y
will
ampliará el
speed up
acceso a los
science
bienes
and
públicos
will
globales
open
para que sean
access
juntos
to
y así
public goods
podamos vencer el virus.
so that we can overcome the
Cada
virus.
compromiso, cada paso al
Each
frente
commitment,
cuenta.
each step
Nuestros
forward
pueblos nos
counts.
observan
Our
y
peoples are
esperan
watching
liderazgos
us
capaces de
and are
trabajar
looking for
colectivamente
leadership
por
which is
soluciones
capable of
verdaderas,
working
por
collectively to
acciones
find real
conjuntas
solutions, for
que nos
joint
permitan sin
actions
egoísmos
which will help us
reconstruir un
without
mundo
any
donde la salud pública
selfishness, work
universalmente
towards a world
resguardada
where public
sea un bien.
healthcare is
Confío plenamente en el
universal and
potencial humano,
safeguarded.
su capacidad de
I
innovación
continue to believe
y en su
in the
comprensión de que
potential
cada
of
vida es una
humanity
historia,
and our way
son
to be
afectos, son
able to
ilusiones,
bring
y
about
que vale el
change. Every
esfuerzo
day
de
is a
trabajar
story, and it's
sin
worth
descanso, de
working
manera
tirelessly
colaborativa, sin
in a
egoísmos,
collaborative way,
en
without
multilateralismo,
any egoism,
sector público, privado,
between the
academias,
public
empresas,
and private
sociedad
sectors, with
civil, para que
academia
pronto
and civil
ninguna
society,
vida se
so that
apague
soon
a
no
causa
life
de esta
will
pandemia.
be lost
De corazón,
because of
a
this
todos los
pandemic.
participantes de este foro, de este lanzamiento
A
y
full
de esta
heart
iniciativa,
to all those
muchas
here
gracias,
at this forum
porque lo que
and to all
queremos es
participating in
apoyar
this
a todas las
initiative.
personas
Thank you
de
very
todo el
much.
planeta
We
que
want to
hoy
support
lo necesitan.
everyone
Muchísimas
throughout
gracias.
the planet who needs this. Thank you.
Thanks for that. I'm going to now give the floor over to the Honourable Mia Motley, the Prime Minister for Barbados. Prime Minister Motley, I hope you're there and can hear us, and you have the microphone.
¿Tienen la lista?
Thank you very much. Can you hear me?
We can hear you loud and clear. Yes, go ahead.
Thank you very much. Today I join in solidarity with President of Costa Rica, my friend Carlos Alvarado Quesada, and my brother Dr. Tedros Adhanom Ghebreyesus, the Director General of the WHO, and indeed my colleague heads of government, to add Barbados' strong support for this launch of this important platform. I also want at this stage to commend and to thank the Deputy Secretary General of the United Nations, my sister Amina Mohammed, for her strong support at the outset of the launch of this platform. Like few other threats in our history, this pandemic shows up our common humanity in the most unequivocal of ways. Through our interconnectedness and our interdependence, the virus has reached all corners of our globe in a matter of months. It is almost like a horror story. Each of us has a story of human and economic loss, and what we write on history's page as our success story is yet to be determined. My friends, I tell you that it is our common humanity that brought us to this point, and it will only be through our common humanity that we will emerge from it. Now let us pause for a minute and think why. The reality is that democracy and multilateralism promised for both the countries and the world respectively that there would be a framework of fairness, transparency, and accountability for those who choose to agree to the compact that led to the democracy or led to the multilateralism. Regrettably, the last few months have brought us closest to the wild, wild west of fictitious fame. We have in the small island developing states stories enough to tell about lack of access to basic medical equipment, medical supplies, and we fear that when the therapeutics and the vaccines come, unless we assert the right of the multilateral institutions of our world to create that corridor of fairness, to reinforce the transparency and accountability that we need, then we are not going to fulfill the promise of the United Nations and the corresponding institutions that came out of the 1945 Pact that allowed the world to have a new order. Access to new data and health products, therefore, to treat and prevent COVID-19 patients must not create winners and losers. And small states, who are often the casualties of market conditions, cannot be dispensable in the wake of this disease. I pause again to indicate that the consortium, the professional consortium being established by the Global Fund in order to procure many of the in vitro diagnostics, cannot simply use a proxy of maternal mortality to be able to determine who should benefit. Because if they do, 13 countries in this part of the world, 10 from within the Caribbean, will be at a serious disadvantage. And we cannot command the types of orders because of our lack of size in order to be able to guarantee access. Barbados therefore calls on all stakeholders to make the tools of this recovery that the WHO and others are working on a global public good. I heard Dr. Tedros just now outline very clearly what we needed to hear as small island developing states. We therefore also encourage all flexibilities in the licensing of these products to quickly scale up global production. And we ask for full cooperation with the UN's Technology Access Partnership so that the global community could exit this crisis together on fair and equitable terms. For this is the promise of the multilateral institutions upon their formation to the people of the world, and it is the promise of democracies at the time of the settlement of independence to our people. Surely, we all know that our markets will recover, and undoubtedly, market competition will return. But for now, it is time to heal. And as we heal, it is time to reflect on the values and principles that led to the modern settlement of the global community in which we function, and to recognize that the challenges that are literally undermining that settlement must be fought on head on, and that the only way we can fight it head on is by those of us who constitute the majority, even if not the power of the few who are at the top, to come together and to assert that transparency, fairness, market access, and accountability must matter and must be attained for the people of the world. I thank you and I wish you all the very best in your deliberations.
Prime Minister Motley, many thanks indeed for that statement of support for this initiative. Fairness and equitable access is clearly the key buzzwords as we continue through this discussion. I'm going to move now to speak to Axel Jacobsen, who is the State Secretary in the Foreign Affairs Ministry in Norway. Mr. Jacobsen, I believe you are on the line, and if you are, then make sure you're unmuted and please go ahead with your statement.
Thank you, Hannah. Can you hear me?
We can hear you loud and clear, yes. The wonders of technology. Go ahead, sir.
Thank you. President Alvarado, Director General Dr. Tedros, colleagues, I'm honored on behalf of my country, Norway, to co-sponsor the Solidarity Call to Action, to establish a platform for open, collaborative sharing of knowledge, data, and intellectual property on existing and new health tools to combat COVID-19. As I speak, the official counts have passed 360,000 deaths globally from COVID-19, and the true figure is likely to be substantially higher. The pandemic represents a tragedy for its victims and their families, and economic hardships for hundreds of millions around the globe. If there's one thing this pandemic has reminded us, it is that challenges that are global can only be faced efficiently if we act together in a coordinated and global manner. It has also reminded us how vulnerable we are when we are confronted with a new virus without efficient tools to fight it. It is now of paramount importance that the world's best researchers and developers join forces in an unprecedented manner to provide us with these tools. Again, global challenges needs global solutions. I'm convinced that the only way to succeed is to collaborate and share knowledge and technologies to have the necessary tools as soon as possible. Once we have effective medicines and vaccines, they should be distributed in a fair and equitable way, according to public health criteria. This is the only way to curb the acute pandemic in the most efficient manner. The World Health Organization plays a vital role in facilitating the necessary sharing of knowledge. Rest assured that Norway stands firmly behind you in these efforts. Thank you again, President Alvarado, for raising this issue and for bringing us together today. Thank you very much.
Axel Jakobsen, thank you very much indeed. We are now going to move on and speak to Her Excellency Ambassador Monique van Dalen from the Netherlands. The ambassador is the representative of the Netherlands to the United Nations in Geneva. I believe you are on the line. I think I saw you earlier. So, Ambassador, you have the floor.
Yes. Okay. Thank you very much, Mr. President, Madam Prime Minister, Director General. The Netherlands supports the need for international cooperation and solidarity in combating COVID-19. The sharing of knowledge, intellectual property and data can play an important role in the development of vaccines or treatments that are affordable and accessible to all people in the world. This is especially true for knowledge that is created with public funding. The sharing must, in order to be effective, have a voluntary basis. We acknowledge that we need industry as a valuable partner. Their capacity to innovate, their expertise in development, production and distribution of vaccines and treatments, and their willingness to take risks must be valued alongside international cooperation, public investments and the sharing of knowledge. The main goal that we all want to achieve is a vaccine or treatment that is affordable and accessible to us all. In an innovation model based on the pooling of knowledge is, next to possible alternative models, a valuable instrument to pursue this aim. We thank Costa Rica and the WHO for their leadership and look forward to continuing to work together in fighting this public health crisis. Thank you very much.
Thank you very much, Ambassador. We now move to Her Excellency Ambassador Maria Ferrani, who is the permanent representative of Brazil to the United Nations in Geneva. Ambassador Ferrani, if you can hear me clearly, then please do unmute yourself and you have the floor.
Okay. Director General, President Carlos Alvarado of Costa Rica, Excellencies, colleagues, ladies and gentlemen. I'm not sure. You listen to me. Are you listening to me? Yes? Okay, so I'll start again. You have to listen again. Director General, President Carlos Alvarado of Costa Rica, Excellencies, colleagues, ladies and gentlemen, Brazil is honored to support this solidarity call to action and to participate in this launch event. We thank President Alvarado for his pioneering proposal and relentless work to bring all relevant partners together at this point. Access to quality, safe, efficient and affordable health technology remains a top priority for Brazil, all the more so in the context of this pandemic. Access to affordable medicines is key to build and strengthen sustainable and resilient health systems, to achieve universal health coverage and to respond to health emergencies. In the case of COVID-19, Universal and equitable access to life-saving technologies is the only way to ensure that everyone, everywhere, will be safe and able to return to normalcy. Brazil is gratified to see that the global strategy and plan of action on public health, innovation, and intellectual property is one of the references for the call to action. Together with many partners, Brazil has led efforts to have this global strategy fully implemented to the benefit of all. We are confident that the call to action will be a major achievement in the public health worldwide, helping us all to rise up to the challenge posed by COVID-19. Thank you very much.
Ambassador, thank you very much indeed. We now take you over to Portugal. Dr. Rui Ivo is the President of the National Medicines Authority in Portugal and joins us live as well. Dr. Ivo, you have the floor.
Hello. You can hear me?
We can hear you very clearly, yes. Go ahead, please, sir.
Thank you very much. President Carlos Alvarado of Costa Rica, Excellency, Director General of WHO, Dr. Tedros Ghebreyesus, distinguished participants from other states and institutions, representatives from academia, international partners, industry, civil society. It is with great pleasure that I send you warm greetings from Portugal and add our voice to the call to action proposed by Costa Rica and supported by the World Health Organization. A call that aims at ensuring equitable access to health technologies through sharing of knowledge and data indispensable to the diagnosis, prevention, treatment and response to the pandemic outbreak of COVID-19. This initiative calls for a global priority in equitable access to health products and refers as to the importance of ensuring the principles of sustainability, availability and accessibility of safe, effective and quality health products, which more than ever are fundamental to tackling the current pandemic. It also stresses the need to guarantee the production, supply chain and equitable distribution of essential health products to our fellow citizens. Finally, considering the potentially devastating economic and social repercussions for health, particularly for developing countries, this section also calls for effective international cooperation in order to strengthen our health systems for this and future pandemics. Knowing that we all share these values, Portugal joins this call to action and its commitment to the collective success in combating COVID-19. Thank you very much for your attention.
Dr. Ivo, thank you very much. We do now have a representative from South Africa. Now we have the Health Minister, the Honourable Minister, Dr. Zwelini Mkhize, who is on the line for us. Dr. Mkhize, please, your supporting statement for this initiative.
Very much. Excellencies, from South Africa, on behalf of President Ramaphosa, I take this opportunity to congratulate the Director General of the World Health Organization, Dr. Tedros, and the President of the Republic of Costa Rica, His Excellency Mr. Carlos Alvaro Quesada, for launching this important initiative. We also appreciate the cross-regional efforts to realize equitable global access to COVID-19 health technologies as a critical response measure, as now more than ever the world needs this solidarity and cooperation to pool knowledge, intellectual property, and data for existing and new diagnostics, therapeutics, vaccines, and for the detection, prevention, and treatment of COVID-19. The solidarity call to action calls on key stakeholders and the global community to commit to undertaking actions which are urgently needed to advance the sharing of knowledge, intellectual property, and data that will benefit all humanity. It is also an important complement to the ACT Accelerator, which was launched a few weeks ago, which aims at making diagnostics, therapeutics, and vaccines for COVID-19 accessible on the basis of need worldwide. We'd also like to emphasize the importance of governments and international partners uniting around a global guarantee that ensures that when a safe and effective vaccine is developed, it is produced rapidly, at scale, and made available to all the people in all countries free of charge. We therefore call upon member states and the international community to support the solidarity call to action to promote health and to ensure the achievement of universal health coverage globally. Thank you very much.
Honourable Minister, many thanks indeed. As those who have been watching so far with this launch, the launch of this initiative, you will have noticed, and we've just had a series of supporting statements, and now we're going to move on to the next part, which is the moderated discussion. So we have a whole array of panellists who are going to be joining us. They're experts, they're industry experts, civil society representatives, members from academia as well. So first of all, I would like to welcome to the discussion Professor Mariano Mazzucato, who is a professor in economics of innovation and public value at the University College London. Professor, I believe you're on the line, and I'm just hoping that your video is on and your audio as well. And my first question to you really is, we're talking about a pool of technology. Why do we need this patent pool right now in the middle of this pandemic? Why is it necessary? There we go. Good. It said that the host wouldn't unmute me. Well, it's absolutely necessary because there's no other choice. I mean, really, from the policy perspective, because this is in fact a policy proposal, we need to frame it as actively shaping and creating this market in the way that needs to be governed to satisfy the mission, which is a vaccine that is globally accessible for free around the world. And that really means making sure that we govern the process from the intellectual property, which of course this common pool is focusing on, the pricing, the manufacturing capability, the international collaboration and solidarity instead of competition between countries. But to do that, it really means also thinking through, what does it mean when countries globally have been putting in billions really into the health innovation market, and then unfortunately, unlike the military, when they spend money on areas that they need, they then govern the process to make sure they win the war. Even though I don't like the war narrative, it does actually mean governing this process in such a way that the pricing, the IPR, the licensing, is done in such a way to really foster what the 21st century is about, which is collective intelligence. Okay, Mariano, that's really interesting. I want to bring in a fellow economist now. Professor Joseph Stiglitz is a professor at Columbia University. Professor, I'm wondering whether you agree with that, whether you think this type of technology access pool is necessary for the distribution of health technologies whenever we come up with them.
Absolutely. Intellectual property is a social construction that is designed to promote innovation. But in this particular case, the government is taking the key role in financing the research, and having those ideas, the most important input into any research is other ideas. And that's why this pool of ideas is absolutely essential if there's going to be the fastest innovation possible. And speed is extraordinarily important in dealing with this pandemic. The longer it lasts, the more people die, but the worse the devastation for the economy. So it's actually important in this case, especially, that there be this kind of patent pool, that this knowledge be used quickly for the benefit of everybody in our global community.
I'm going to try and connect now with Dr. Jacques Dubochet. I'm hoping that he's on the line as well. Dr. Jacques Dubochet is a Swiss scientist. He's also a Nobel laureate. Sarah, I can see you. Wonderful. I know that you've advocated for open science. I'm wondering if you can just explain to all of us what exactly you mean by that, and the role that you think that science should play going forward with this initiative.
Oui, vous voyez, le COVID-19 est un intéressant exemple d'un mal commun. Il est méchant avec nous tous, et tant qu'il existera quelque part dans le monde un malade, ce malade est à nous tous. Et l'épidémie peut revenir, elle est avec nous tant qu'il y a des malades. C'est un mal commun. mais à tout mal commun, on peut faire correspondre un bien commun. Et ce bien commun, c'est cette connaissance que tout le monde est en train d'acquérir et qui, peut-être un jour, bientôt, va nous aider à soigner, à guérir un bien commun. Faisons ce bien commun. Et c'est justement l'idée de cette initiative que de la porter et que tout le monde travaille à cela. Mais il y a plus, parce que c'est un exercice formidable. Un exercice visible, on en a besoin et il nous prépare à un autre mal commun que nous avons besoin de traiter comme bien commun. C'est bien, c'est le problème du climat et le problème de la vie qui se dégrade dans l'ensemble de notre planète. Le virus, nous en sortirons et nous sommes au travail maintenant. Bravo, grâce à cette initiative. La planète, c'est la suivante. Et c'est pas la plus petite. Bonne chance à nous tous.
Boa sorte a todos nós.
Dr. Dubochet, many thanks. We are going to move on now and hopefully speak to Philippe Duneton, who is the ad interim executive director at Unitaid. Mr. Duneton, if you can hear me, I hope you can. Unitaid is a huge WHO partner and very much involved in this particular initiative. Can you just describe for those watching in the media, the public as well, what exactly Unitaid's role will be with rolling out this type of pool?
Hello, good afternoon and good morning for everybody. I hope you can hear me. So it's quite important as an initiative and call for action. Unitaid is fully involved in the development of therapeutic and diagnostic under the ACT call for action, and we are working closely with partners, but also with WHO, of course. And finding the right medicines, the right diagnostic and the right vaccine is not sufficient. As it was said, it's quite important to make sure that it can be affordable everywhere at a low price. As Unitaid, we have a lot of experience in making the connection between the innovation and, of course, the scale-up. And we have created 10 years ago now the medicine patent pool that is coping with of course, the industry to make affordable medicine for HIV and, of course, hepatitis C. It is a great success because now, as I speak, we have a million of people who can benefit from the latest innovation to fight HIV. And I think that this initiative today is very important also to make sure that we will have equitable access for the new vaccine, for the treatment that we need to fight COVID-19.
Thank you. Let's bring in Greg Alton. Greg is a former Chief Patents Officer for Gilead. Greg, if you can hear me, and I hope you can, we're obviously talking about patents now and intellectual property. I'm wondering, and I'm sure many other people watching this will be wondering as well, with all good intentions aside, what will it take to get companies on board to share their intellectual property and their knowledge?
Great. I think I'm on mute. Is that?
Yes, you are. Yeah.
Okay, great. So first, let me just hold on. I got something weird on my screen here. Let me just start with, I think that, and Dr. Tedros said this initially, I'm a big supporter of intellectual property and the role that the industry's played in bringing medicine forward. However, with some things, I think that, the reason I'm very supportive of this call to action. First of all, in terms of fair and equitable access, I do think it would be fantastic to see the industry come forward and commit to working with the medicines patent pool or other mechanisms to make the intellectual property that comes out of the products that we develop, whether they're vaccines, therapeutics, or diagnostics, to be produced by generic manufacturers and then made available in fair and equitable terms globally. I do think to make this happen, we have to expect and respect that different companies will have different concerns that they're going to have to be addressed around whether, if this is truly voluntary, geographies, around different tierings of geographies, understanding that the poorest countries of the world, what's fair and equitable for them will differ from middle income countries, that will differ from wealthy countries. That's the way the industry is going to look at this. I think they're going to look at protection around their commercial interests, their indications, their uses. But I do think this can be done. We've seen this done we did in HIV, we've done this in hepatitis. I do think it's a good model, and I think I would love to see the industry come forward today while these products are being developed and make a commitment to make these products available for generic production, for local production, and get to what those terms are that will be acceptable. And it's going to vary from country to country. The other thing I just want to touch on why I'm very excited about this call to action is we don't have these products yet. We do not have the therapeutics. We do not have the vaccines. We do not have the diagnostics we need. I do also believe that the component of pooling knowledge, pooling data, creating a forum where this data can be shared to create those new breakthrough products is more important today given this epidemic than we've ever seen before. The human and economic costs. We cannot wait for the typical development timeline of a vaccine or a therapeutic. And I think this is an opportunity to see if this pooling of knowledge, sharing of information, sharing of intellectual property, of breaking down these barriers can expedite that development and allow these breakthroughs to come through. And if this works in COVID-19 or in this particular epidemic, maybe then this model could be used for some of the neglected diseases around the world that the current IP and industry model doesn't work well for.
Greg, thank you. I wonder if I can just bring back Professor Joseph Stiglitz to comment on that, really. I'm wondering whether, Professor, you think that we can perhaps use this concept of a patent pool as an opportunity to prepare for future crises as well.
Well, very much so. And what I wanted to emphasize are a couple points. One, the production of knowledge, as I said before, the most important ingredient is other knowledge. And when speed is important, as it is in this pandemic, you want that knowledge to be shared very quickly. What's interesting is that talking to my friends who are in the research community, that is happening at the individual level. But the question is, will the corporate level, will the institutional level buy into this? And what I find so exciting is the commitments being made all over the world in support of this. There's a second aspect that I want to highlight, which is we're going to need billions of doses of whatever medicines are going to be produced. That means it's really important to scale up at a low price. And the point, as long as this disease is going on in any part of the world, we're all going to be vulnerable. So it's really important in the interest of all of us that the prices be low. And that's not going to be achieved through monopoly pricing of the drug companies. It's only going to be true if we make sure that there's access to generics, to local producers, the widest dispersion of production. Now, there has to be return to those who are making their research, although much of the money is coming from the government. We should be clear about that. It's been de-risked. But we can do that through royalties, through charging for appropriate prices. That can be done within the patent pool. But what is really important here is the prioritization of speed and price accessibility. And that's really the idea behind this initiative, which I really commend you for.
And Mariana Mazzucato, I believe you want to come in on this.
Yes, I mean, I really think this is going to be the moment to make sure that we walk the talk of what kind of public-private collaborations should be in a space like this. And I don't think hepatitis C is a good example, with all due respect, Mr. Alton. This is actually the area where so many have written about, an area which received billions from, for example, the National Institutes of Health, 10 years of research, and then ultimately was marketed for $84,000 for a 12-week course, one pill a day. Now, that whole issue of how can we actually produce, again, as I was saying before, along the whole value chain, so governing the patent system, as we're talking about today, but also the pricing system that really reflects that collective effort that we're making in so many different parts of the health industry. This is a problem that goes beyond vaccines. Why this initiative is so important is we cannot risk getting it wrong. We have to today use this almost as a sandbox that hopefully will also create lessons for other parts of the sector. And in terms of what Joseph Stiglitz was saying, you know, of course patents are important. They have simply been massively abused. They are too upstream. We today are patenting the tools for research. They're way too strong, hard to license. They're too wide. They're used for strategic reasons. So again, using this moment to also think much more broadly, how can we make patents do what they were meant to do in the beginning instead of really just fueling a lot of rents and monopoly power?
Mariana, thank you. Charles Gore is the Executive Director of the Medicines Patent Pool, which Dr. Tedros mentioned at the beginning of this launch. And Charles Gore, if you can hear me clearly, based on your experience at MPP, when you have a patent pool already, can this scale and level of cooperation work? Does it work in practice?
Thank you very much indeed, Hannah. And just before I answer your question, I'd like to thank WHO and the Director General, Costa Rica and President Alvarado for inviting us to be part of this initiative. Perhaps I should just talk a little bit about our history to answer your question. So we were set up by Unitaid in 2010 as a public health organization to do voluntary licensing to enable access to HIV medicines and also to facilitate the development of new treatments in the form of, for example, pediatric combinations, single pill combinations, but also to make sure that, first of all, access was as quick as possible and also as equitable as possible, as Dr. Tedros said, to make sure that no one was left behind. And the success of that model led to the global community asking us to expand our mandate, firstly to HIV, hepatitis C and TB, and then more recently to any patented medicine on the WHO essential medicines list. And the model involves, first of all, working with experts and the affected communities and civil society to identify the needs, then working with the pharmaceutical industry to actually get the licenses, which we can then sub-license to many generic manufacturers that allows both scale up to meet large demands, but also competition between the generic manufacturers to drive the price down. And then finally, with also governments and the affected communities to let them know what is available to make sure that they do access these affordable but high quality drugs as quickly as possible. And finally, to manage this whole process. I think you can see from the fact that, as Philip Dunton mentioned, we've had a huge impact. I'd just like to mention that our generic manufacturers have now delivered 12 billion doses in the last 10 years. And based on that, our board at the beginning of the COVID crisis decided that we should offer that expertise and experience to the global community if it would be useful, and consequently expanded our mandate to include anything that could be useful for COVID-19. And so we're now